When you have a bad night of sleep, it can disrupt your whole day, possibly affecting your physical and mental well being. Now, imagine multiple restless nights. As many as 35% of adults around the world suffer from insomnia, or it is the difficulty of falling and staying asleep. And this condition can take a serious toll on your health. In fact, it's associated with a number of diseases like diabetes and heart disease. On the program today, we'll talk about the causes for insomnia and how it can affect our health. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. Our guests are here today to tell us more about insomnia. With us is Dr. Jacqueline Denise Palinis. She is a neurologist and sleep medicine specialist from the Batangas Medical Center and Mary Mediatrix Medical Center. Also with us is Lordy Angelo Santos. He's a clinical psychologist from the Sleep Center of St. Luke's Medical Center in Quezon City. Thank you both for joining us on this very interesting topic, applicable for those who are having trouble keeping themselves asleep at night. Now, along with diet and exercise, we all know that sleep is one of the foundations of good health. Now, I'll start the conversation with Dr. Dens. Let's talk about why we need to sleep at all. So we have a lot of people that are saying, yeah, we need 8 hours of sleep, but why do we need to sleep at all?
So you are correct. Sleep is one of our essentials when it comes to healthy life. So you have to think of it like the way you need to eat, the way you need to drink water. So you need to rest, you need to sleep. Maybe one of the more significant things that we have to remember about sleep is that it helps us prevent to have other illnesses. So sleep is associated with good immune functions. We need to sleep when we are sick. So if we do not get enough sleep, we will have problems like, as you've mentioned, hypertension, diabetes, and obesity, and other complications that come from there. Sleep is also important for our memories. Sleep is important for us to have a good emotional health.
Sleep is restorative for our every cell in our entire body, for that matter. But sometimes we can't help but experience difficulty in falling asleep, and possibly those who suffer from that may have insomnia. Now, Dr. Dens, if someone has difficulty sleeping, automatic insomniac na ba sila?
So insomnia is defined by having trouble sleeping or having trouble staying asleep for about 3 nights per week or more. So one bad night of bad sleep does not equal insomnia per se. But if you have trouble every night sleeping, if you have trouble staying asleep, and it can extend for months at a time, that is called insomnia already.
Now, Lordy, for those who might have trouble sleeping 1 or 2 nights, or for those who are having trouble to sleep longer than that, ano yung mga common triggers ng condition na to?
With regards to the common triggers, or these are basically known as precipitants of the symptoms of insomnia, it may actually vary from person to person across different age range. Like for example, for those individuals who are currently in their teens, well, we can expect them to engage more time on gadgets or unhealthy activities during the night that might actually delay their sleep onset. The older age, people might already suffering from different medical conditions that might also impair the quality and the onset of their sleep. Towards the middle age group, there are also other activities that may initiate the onset of these insomnia, such as giving too much time to work on their projects, which might initiate delayed sleep. And if not addressed properly, it might develop into a full-blown insomnia.
Is stress a powerful factor impeding someone's ability to sleep and stay asleep?
Yes, I agree that stress could actually affect someone's sleep quality and sleep quantity, as it might trigger other symptoms of mental health problems such as anxiety and depression, which in the long run could really initiate or trigger the onset of the experience of insomnia.
Dr. Dens, for those who are having trouble sleeping and they just want to sleep right away, and then naghahanap na sila kagad ng something to make them fall asleep, either medication or alcohol, Is this a good way to fall asleep when it comes to having 1 or 2 bad nights of sleep?
So in general, we want to avoid self-medication. Okay. It's a lot better for us to rely on good sleep habits to be able to achieve sleep rather than relying on substances such as alcohol or medications for us to fall asleep. Because alcohol is really not appropriate to start sleep. It's going to cause poor sleep quality, and medications may not always be safe for everyone. So it has to be tailor-made for you if you actually need it. So we have to focus more on setting a good schedule for sleep. That's the most important thing. We want to make sure that we go to bed at the same time, we get up at the same time. We want to avoid anything stimulating before going to bed. So that includes uses of gadgets, any uses of substances like smoking. We want to make sure that you are relaxed before you go to sleep. And we want to make sure that your sleeping environment is actually conducive to sleep. So the best sleep is the one that is natural. And, most of us really do not need to take anything for sleep. So that is the goal for everyone who is having trouble sleeping.
That's a very good point, which we will discuss right after the break, because having good sleep habits can manage insomnia, which, if not managed properly, could lead to a host of medical problems. And we'll talk more about these when we return. We're your partner in healthcare. Keep it here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk. When you're feeling stressed and anxious, or if you have an irregular sleep schedule, it might make it difficult for you to fall or stay asleep. And in turn, it could make it hard to function during the day. And if your insomnia lasts longer than a few days, it could even lead to potential health risks. Now, before we talk about the potential health risks, I want to go over some of the red flags, some of the things that our viewers can find out kapag mukhang nagkakaroon na sila ng insomnia. Lordy, could you give us some symptoms of someone who is or may have insomnia?
Okay, the primary symptom of insomnia that we want to look for is inability po not to have that restorative kind of sleep. As what Dr. Den said earlier, these set of sleep episodes should have occurred for at least 3 nights or more in a week. And if we continue to have this kind of sleeps that are non-restorative, after nating matulog, pagod pa rin tayo, no, parang nahihilo pa rin tayo or masakit pa rin yung ulo natin, then those may be some of the symptoms that we may want to take note of.
Now, Dr. Dens, when it comes to the more serious effects of prolonged insomnia, ano bang pwedeng mangyari sa katawan ng isang tao kapag hindi na-address ang kanilang insomnia?
So people with prolonged insomnia are more likely, they're going to have prolonged sleep deprivation also. And it is really sleep deprivation that leads to the ill effects on the body. So if we do not give our body a chance to restore itself, that is when the problems will occur. Chronic sleep deprivation is associated with poor cardiovascular health. So it's associated with hypertension. It's also associated with metabolic disorders such as diabetes. People who are not sleeping well are more prone to unhealthy weight gain. A lot of people who have poor sleep are more prone to catch infection. So this is a little significant right now because of the COVID and the monkeypox outbreaks that we have to think about. So sleep should be part of our protocol in keeping ourselves safe. As mentioned before also by Sir Lordy, people who are not sleeping well tend to be more anxious. They tend to be more depressed. These are just a little bit of the things that can happen when we do not sleep well.
Yeah, so dapat talaga ma-manage ang proper amount of sleep, quality sleep for that matter. Now, before we go to talking about what is quality sleep, Lordy, bakit yung mga elderly, yung mga senior citizens pataas, bakit sila ang madalas may problema sa pagtulog and maintaining their sleep?
Okay. One of the most common reasons, Doc, of course, are the co-occurring medical conditions that might let them experience, for example, excruciating pain while they are trying to sleep. Those medical conditions that would actually require them to have frequent bathroom visitations while they are asleep. So upon waking up, they will be having trouble going back to sleep. No, there are also some medical conditions wherein insomnia are considered as one of the behavioral and psychological consequences, such as for those individuals who are suffering from dementia.
Now, Dr. Dens, when it comes to trying to find that good sleep, that quality sleep, ano bang pinag-uusapan natin dito? What is defined as quality sleep?
So quality sleep is sleep that makes you feel good. Okay, so it means that when you go to sleep and then you wake up, you feel energized. There are discussions of how long is the ideal sleep. So actually, there are a couple of factors that we have to talk about. So number one, the age of the patient. So younger people, such as teenagers, especially children, they're going to need more sleep than adults do. And as we grow older, we will notice that our times of sleeping will be a little bit shortened. For the length of sleep for adults, it actually depends on you. So the average is 7 to 8 hours of good quality sleep. That's enough for most of us. You have to consider yourself as well. You're going to know yourself best how long you need to sleep, and you have to listen to your body. So if your body says, I need 7 hours, you need to take 7 hours of sleep. Another factor for sleep is good quality. Sometimes we have medical conditions and sleep disorders that will interfere with the quality of sleep. The most common is probably obstructive sleep apnea. We might be able to talk about that later. But if you have a hard time breathing during sleep, for example, that's not going to be good quality sleep, and we need to see you for that.
Now that we know what quality sleep is and what those with possible insomnia need to achieve, Lordy, when it comes to insomnia, posible ba na ang mga bata, those who are in grade school, high school, is it possible to be that young and to have insomnia dahil sa poor habits or whatnot? Is it possible na may insomnia na yung anak ng isang magulang na hindi nila nakikita?
Yes, it's actually possible, Doc. No, yun nga lang, it's actually rarely seen, especially in the Filipino setting. No, because we usually see our children to be more energetic. So we really need to consult a medical specialist to see and to assess whether these children are really showing symptoms of insomnia. But whenever they experience this kind of insomnia as compared to adults, again, they rarely manifest. But we can actually see it through, for example, if they're already studying, we can see how these young children can actually have less attention, for example, less concentration abilities, and may actually become more easily irritated, for example, with regards to their activities with their peers, or maybe whenever they're communicating with other people.
Now, Dr. Dens, earlier you touched on obstructive sleep apnea. Could this be a possible cause for insomnia?
Absolutely. Okay, so obstructive sleep apnea, just so everyone is clear, it is a medical condition and it usually presents as loud snoring when you go to sleep. So when you snore, it means that the air is not entering your airways properly and you might not be getting enough oxygen when you sleep, and that's going to tire your body out. That's going to lead to poor quality sleep. So medyo suspicious po tayo if you feel that you're able to sleep but you can't maintain sleep and someone tells you na, ay, maingay ka kasi matulog. So in this case, it might be helpful for us to ask our husbands or wives, our partners, if we are noisy when we sleep, because there might be a problem that we are not aware of.
Now, lifestyle changes are also key in managing these sleep disorders and keeping us healthy. More on this when we return. Your health is our mission here on MedTalk Health Talk. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk. Now, sleep plays a key role in maintaining our health. When we lack restful sleep, now it can also lead to a number of diseases as well as mental health problems. But there are small lifestyle changes that we can make in our everyday to promote a good night's rest. Now, Dr. Dens, let's talk about that. We've been talking about trying to avoid insomnia by having good sleep habits, having good sleep hygiene. Please talk to our viewers about that.
Okay. So, sleep hygiene is just a fancy way of saying you have to have good sleep habits. And the habits is something that you have to do consistently for them to really work. So, the most important thing for sleep is to have a good sleep schedule. So, it'll be very difficult for us to maintain our body clocks if we do not have a good schedule for sleep. The principle is that you want to go to bed at the same time every night and you want to get up from bed at the same time every morning. So, you have to consider what time you need to get up in the morning for you to be able to go to work, for you to be able to prepare. So my suggestion is that you base your sleep schedule on the time that you have to get up in the morning. So another important thing is that we have to limit the time that we spend on bed. Okay, so it's really better for you to segregate your activities away from the bed. Okay. Another thing, we have to have a good environment for sleeping. Limit the things that are stimulating to you away from your bedtime.
Now, Lordy, for those who feel that kung anong tulog ang nawala nila, that they can sleep it off in the weekend. Magpapakapuyat sila ng Monday to Friday and then they'll just sleep the entire weekend. Posible ba to catch up on sleep?
Okay, it's actually difficult no, to catch up with this amount of time that we've missed for example, for an all-nighter. Most research suggests that we cannot actually spend, for example, a single weekend just to make up for these lost hour of sleeps. And there are actually certain experiments that told us that it would require us to work on it for about months or maybe for even half a year just to make up for that loss of sleep.
But Lordy, a lot of these people who lose that sleep is because they have, like what you said, an all-nighter, probably for work, probably for schoolwork. Part and parcel is that is the stress and anxiety in trying to get things done, which can be a risk factor for insomnia. So what advice can you give for parents of children who are working so hard for their schoolwork, they're losing their sleep, or for those who are at work trying to finish deadlines? How can they manage that stress and anxiety better to get that quality sleep that they need?
Okay, for the parents, they could actually provide a more supportive environment. As mentioned by Dr. Den, there are actually a set of guidelines that we may follow to make the environment more conducive for these children to have a good night's sleep. Already related to the experience of anxiety or other mental health concerns, better if we could really consult a mental health specialist or a sleep specialist because for these treatments or intervention procedures, it have to be personalized no, to these children. It's actually difficult to give a direct advice how to treat or resolve this kind of problem because there are a lot of factors that needs to be considered or collected first before we can directly address or improve that kind of situation.
Now, Dr. Dens, when it comes to sleeping pills and insomnia, what are the mainstays for treating insomnia, or are there better ways?
Okay, so the very first thing I have to say about sleeping pills is please don't take them unless a medical professional tells you so. You have to take them as they are prescribed, and sometimes you are instructed to take them only as you need them. So one of the popular things that people take to sleep is melatonin. Okay, so it is sold as a supplement. But we have to remember that melatonin is actually a hormone. So it's produced by this little friend that we have in our brain called the pineal gland. And it is secreted at the times that we are supposed to feel sleepy. When we take supplemental melatonin, we support the natural rise in melatonin that our brains have. And if we take too much melatonin, it may cause problems. My suggestion is that you ask a medical professional first on how to take melatonin.
Okay, that is true. And as an advice, never self-medicate, especially things like sleeping pills. They could do more harm than what you are intended it to do. Now, before we go, Lordy, do you have any advice for our viewers, especially when it comes to trying to prevent insomnia?
Participate on different activities such as exercise, proper sunlight exposure. We could also try to avoid drinking caffeinated beverages closer to our preferred time of sleep. Avoid alcoholic beverages, large amount of alcoholic beverages as well. And maybe have some good amount of milk.
And of course, Dr. Dens, any advice for our viewers?
So really the most important thing is that we prioritize sleep. we don't just set it aside because we think that it's not important, because it really is important for ourselves. And we have to really make sure that our sleep habits are up to par. When you think that you have a difficult time sleeping, even if you feel that you have good sleep habits, you have to seek professional help. You owe it to yourself.
So marami tayong natutunan with regards to having good quality sleep, preventing insomnia, and trying to manage that stress in our lives that may impede our quality of sleep. So with that, thank you very much, Dr. Jacqueline Denise Palines and Lordy Angelo Santos, for being with us, sharing your information with our viewers with regards to insomnia and sleep. I'm Dr. Freddy Gomez, and we'll see you again next time here on MedTalk Health Talk.